I welcome you all to this Facebook Live session on respiratory distress or breathing difficulty in newborn. I'm Dr. Aparna, Chief Neonatologist at King's Cuddles, Kondapur, Hyderabad. We have a tertiary care neonatal intensive care unit, and one of the commonest reasons that newborn babies get admitted into the NICU is breathing difficulty. So in Telugu, we say swasa తీసుకోవడానికి ఇబ్బంది, ayasam. Various terms are used to describe respiratory distress. So first, let us try and understand what do we mean by respiratory distress in newborn babies. So in newborn babies, that is babies less than 1 month age, the presence of any of the three criteria, which include fast breathing, indrawing of the chest, and abnormal grunting sounds. So the presence of one or more of these criteria qualify for the term respiratory distress. So how fast is fast breathing in a newborn baby? So usually the breathing rate of a baby would be something between say 30 to 40 or 50 breaths per minute. Now, if the newborn baby starts breathing at a rate more than 60 breaths per minute, it is called as fast breathing. In addition, the other signs of respiratory distress are the presence of lower chest indrawing and the presence of abnormal sound when the baby breathes out. So this sound is called as grunt. This, along with some other useful signs like decreased oxygen levels or saturations, which fall to levels below, say, 92% when the baby is not given any additional oxygen. And the presence of other signs such as the flaring of nose. So you would have seen sometimes when the baby has some breathing problem, the nasal cartilage tends to move up and down. So this and the nodding of the head rhythmically whenever the baby takes breathing. All these signs put together indicate that something is not correct with regard to the baby's breathing. Next, let's try and understand what are the common reasons why newborn babies can have issues with breathing. So the commonest organ which is responsible for breathing difficulty is of course the lungs. So in the lungs, you could have a baby having breathing difficulty due to one, a condition called TTNB or transient tachypnea of newborn. Two, it could be due to a condition called respiratory distress syndrome, which is typically seen in preterm infants. Thirdly, we can have conditions which can lead to infection within the lungs called as pneumonia. Finally, we can have babies with some other issues in the lungs like birth defects in the lungs, what we call malformations, or the presence of air leak around the lung called pneumothorax. So these are some common reasons why babies can have breathing difficulty. So A, transient tachypnea of newborn. This is commonly seen in normal term babies, full term babies who may be born with more water or liquid content within their lung. Even normally when babies are born, the babies are born with wet lungs. It is only when the baby takes the first breath that the lung fluid is expelled out of the lung and the lungs get filled with air, like it is with all of us. This process can get delayed in some babies, leading to fast breathing, which spontaneously or normally settles on its own without additional medications in the first few hours after birth. So remember that if the baby's breathing difficulty keeps on increasing, then it is unlikely to be due to TTNB or due to this transient tachypnea, which in turn is due to more or excessive lung fluid. The second condition called HMD, hyaline membrane disease, is because of prematurity. So if a baby is born preterm, the baby's lungs may lack a substance which is called surfactant. Surfactant in the lungs is responsible for keeping the lungs expanded and prevent lungs from collapsing. This chemical normally develops and is present in full-term babies in adequate quantity. But in preterm babies, surfactant can be very low and this can lead to breathing difficulty. The other common causes are infections in the lung called pneumonia and the presence of air around the lung, which is sometimes due to air leaks. And finally, we have babies who are born with rare birth defects which involve the lung, like a diaphragmatic hernia or diaphragmatic eventration or cystic lesions within the lung, etc. Now, in addition to problems in the lung, breathing difficulty can sometimes be a sign of issues or diseases in other organ systems like heart, like the hemoglobin or hematological system, issues in the brain, and there may sometimes be issues in the acid base balance of the baby. There could be problem in the baby's abdomen. All these can cause breathing difficulty as a non-specific sign. For example, heart problems or defects in the baby's heart, what we call as congenital heart defects. This group of conditions wherein the baby's heart structure is abnormal by birth can itself be responsible for breathing difficulty. So some of the common examples are the presence of a hole in the heart called as ventricular septal defect, the presence of abnormal positioning of the great vessels, the aorta and the pulmonary artery. Sometimes you may have a baby who has had a valvular block. All these babies can present with breathing difficulty. And in addition, we may have babies with a lot of acid level in the blood called as metabolic acidosis. You could have babies with low glucose, hypoglycemia, high hemoglobin, polycythemia, or babies who may have an intracranial problem like bleeding in the brain, which can happen in some severe conditions which affect the baby's brain or the baby's transition. So in all these conditions, breathing difficulty may be a very non-specific sign. So what do we do when we see a baby who is having breathing difficulty? So you would of course bring the baby for seek the help of your doctor, a neonatologist, or a pediatrician, and this is what we generally do. So first and foremost, we try to get an assessment of the baby's severity of the breathing difficulty. So we try to see whether this is mild, moderate, or severe. And how do we do this? We have some scoring systems to assess the severity of each of these signs. We also have some additional investigations which can help us to understand the extent of low oxygen or high carbon dioxide levels, particularly the arterial blood gas analysis. So this is a test which helps us to understand the dissolved concentration of the blood gases, oxygen, carbon dioxide particularly. Now, once this is done, the second important aspect is to find the reason for the baby's breathing difficulty. This is often established by taking a thorough history, by doing an overall examination of the baby, including a cardiac examination, by getting some investigations, some blood investigations, both on the mother and the baby. So this may include blood counts, hemoglobin, platelet count. We may have to get a chest X-ray to understand how severely the lungs are involved or whether the lungs are involved at all, whether there is any cardiac abnormality. If there is a suspicion of a heart problem, we may have to get an echocardiography for confirmation. We may further plan some higher diagnostic modalities like an ultrasound chest or a CT chest based on the clues that we get from the basic evaluation. Now, in terms of treatment, the babies who have breathing difficulty are often provided breathing support by means of giving oxygen, sometimes by means of giving non-invasive or nasal ventilation in the form of CPAP, in the form of non-invasive ventilation. We may sometimes have to also provide higher modalities of respiratory support in the form of intubation and ventilation support. So this may be required in a very small subset of newborns, but nevertheless, it can be only provided in tertiary care NICUs where you have optimal monitoring of the babies. Now, in addition to all these things, a specific treatment of the underlying illness is very, very important for complete treatment of the problem. So this may be possible in the form of replacing surfactant in hyaline membrane disease, which I told you previously is due to prematurity. So the treatment of surfactant deficiency is to replace surfactant externally by introducing surfactant through a feeding tube. We may also have to give IV antibiotics for the baby if the baby has infection or pneumonia. Now, if there are birth defects involving the lungs or the heart, this has to be then appropriately diagnosed, confirmed by imaging studies such as the CT, and may have to further be rectified by surgical repair. Now, based on the severity of the problem and the size of the defect and the extent of clinical symptoms, one decides whether to operate immediately or to operate at a later date. Now, if the baby has breathing difficulty due to cardiac issues, you may be able to manage the breathing difficulty temporarily by giving cardiac anti-decongestive measures or medications to reduce the blood flow to the baby's lungs and to reduce the congestion from the baby's lungs. But the ultimate treatment may have to be decided based on the type of the cardiac defect. Some of them require surgical correction. Some require non-invasive or cardiac catheterization technique related interventions. Now, these are all modalities to treat babies with respiratory distress. Now, can something be done to prevent babies having severe respiratory distress? So, first and foremost, we must remember that there are some things that we can definitely do. So, if the mother, for instance, is at risk for premature delivery, then there is something called antenatal steroid injections. These injections, when given to the mother, intramuscular injections, can protect the baby's lungs and can actually help the lungs become more mature, and this can avoid the baby from requiring CPAP, surfactant, etc. after the baby is born, even if the baby is born preterm. So this is something which is regularly recommended in mothers who are likely to have preterm delivery between 24 and 34 weeks of pregnancy. So this injection is a very readily available injection, and all your obstetricians will be able to provide more information regarding the injection, the dose involved, and the safety aspects. By far, antenatal steroids are life-saving when it comes to enhancing the baby's chances of survival, particularly if the baby is born preterm. Now, secondly, if and when the baby is found to have respiratory problems after birth, do not hesitate or do not delay seeking early intervention or early support. Remember that the timely initiation of appropriate respiratory support for the baby can largely help, or to a large extent avert complications such as air leaks, can prevent complications like the baby going on to ventilator, etc. etc. So this is something that should be borne in mind, that whenever there are anticipated problems, like if the baby is expected to be preterm or if the baby is expected to have, say, a birth defect based on the scans, then always plan your delivery in a setup where there is access to the tertiary care NICU service, like we have in Cuddles. So this is another very important step. Now, the third thing which we all need to be increasingly aware is to give the right kind of breathing support if the baby has breathing difficulty. Now, in the olden days, this used to be often done by giving just plain oxygen support. But these days, we have realized that just giving oxygen in the place of giving pressure to the baby, or what we call CPAP or PEEP to the baby, can actually result in a lot of side effects, particularly to the baby's eyes. So always remember that there are excellent modalities of breathing support now available in the form of the newest of CPAP machines and ventilator devices. And every baby who has breathing difficulty should be appropriately assessed by a qualified doctor, pediatrician, or neonatologist for taking an appropriate decision on which is the right mode of breathing support for your baby. So these are all the things which we would like you to understand about breathing difficulty in newborn. Now, also remember that some of the less common conditions are things which we often need to keep in mind. Now, very often when it comes to the outpatient practice, we often get to hear families complaining that the baby is having running nose and nasal block or noisy breathing. Remember that every noisy breathing is not equivalent to respiratory distress or breathing difficulty. In most of these situations, The only thing the baby requires is saline drops to decongest or to clear the baby's nostril. So very often these are because of nasal secretions which tend to block the baby's nose and lead to the baby having breathing difficulty. So with these words, I think I'll conclude here, and if there are any questions, we should be happy to take them up. If there are no questions, sorry?